of the colon. Second is dietary factors. So, we overall, the Indian diet has a good fiber component, but again, what we eat every day is also changing. So, low fiber intake and insufficient fluid or hydration is also a very common contributor of constipation. And then last thing, medication. So sometimes if you're having worsening constipation, it's a good idea to look at the medications you're on, sit with your doctor and go through them, because sometimes there can be culprits in those medications, especially calcium channel blockers. Those are medications that we use for high blood pressure, arrhythmia. They can also lead to constipation. There are secondary causes for constipation. So if you have hypertension, underlying high heart disease, diabetes, hypothyroidism, those all affect the motility of the GI tract and contribute to constipation. So if we have any of those, it's a good idea to again discuss with your doctor if it's well managed, and then integrate motility, mobility, exercise, hydration in your protocol every day. There's also irritable bowel syndrome, very common amongst people. About 1/3 of the population at any point of time has it, which can also contribute to constipation. And then lastly is neurological issues like Parkinson's, stroke, anything affecting neurologically your bowels will cause constipation. What are the basic lifestyle things
Dr. Trita,
yes.
maybe will you make it into presenter mode so we can see the slide better?
Okay, sure.
Just go into slideshow and it will have
Yeah, let me
on the
do
right
that.
side. Go all the way up on the right side.
Oh, yes. Okay.
Slideshow and yeah.
Okay, is this
Yeah,
better?
perfect. Yeah,
Okay.
good.
So what are the big things the basic lifestyle things that we say to anybody with constipation is three big rules: fiber, fluid, and physical activity. So a daily intake of 25 to 35 grams of fiber is recommended, and the best source is to get it through food. If you cannot get it through food, obviously there are many supplements you can use. So the examples of high fiber foods, and I'll have another slide dedicated to this, is whole grains, lentils, beans, vegetables, fruits. There's now studies that if you eat 2 kiwis a day, you can improve your stool frequency and consistency in individuals who have chronic constipation. The second is fluid intake. So for most of us, unless we have underlying heart or lung issues or kidney issues, 1.5 to 2 liters of water a day, and I tell people even more than that, is generally what is needed for your colon to have a soft bowel movement and also effectively support the fiber intake that you're having. So you need fiber and you need water. And regular physical activity. And there's different ways to measure physical activity, but a benchmark, a common denominator we generally say is 30 minutes of moderate exercise, like a brisk walk. And the good number is 5 days of the week. So 150 minutes of cardio in a week is generally considered a good number for cardiac, for bowel motility. Again, just giving you some numbers. Average numbers for daily recommended fiber intake for men is about 30 grams, for women about 20 grams a day. If you go anywhere between 25 to 40 grams of fiber a day through your diet, you're probably hitting your fiber goals. In the Indian diet, what are the big sources of fiber? So whole grains, right? So millets, which is ragi, bajra, brown rice, whole wheat, legumes, so a lot of our dal, chickpea, kidney beans, vegetables, fruits like guava, papaya, pears. A good rule for fruits is anything that starts with a P is generally high in fiber. So papaya, pears, prunes, generally good sources of fiber. And then just incorporating flax seeds, chia seeds in your smoothies, in your salads is again a good source of adding fiber. Obviously, if the dietary changes are not working, then there is medications and supplements that we can introduce. Again, I always start with supplements and non-prescription medications first. The fiber supplements can be, these are easily available in Safeway, in Walgreens. There's Citrusel, Metamucil, there's Isabgol, which is basically the equivalent of Metamucil. Most of the times I tell patients to take 1 to 2 tablespoons a day. It's very well tolerated. It helps with constipation. It also helps your good cholesterol. Then there's magnesium oxide. I really like magnesium oxide. It's over the counter. You can start with something like 200, 400 milligrams a day. I tell people to take it at bedtime. It helps you sleep better. It helps nerve conduction. It helps anxiety, and it helps constipation. So great supplement to take. And then polyethylene glycol, that is Miralax, easily available, 1 to 2 tablespoons a day. Very, very safe. It's not absorbed in your GI tract. If you have to take 1 tablespoon a day to just help you have good bowel movements, we give it in pregnancy, we give it to kids. Again, very, very safe. And then if all that is not working, by then you're probably going to see somebody like me or your primary care. And there are a whole bunch of prescription medications that we will not go into that we have for management of chronic constipation. But I do think majority of people, if we start following the diet, the lifestyle, and some of these supplements, most of the constipation will get better with these interventions first line. And then just addressing underlying conditions like we talked about and reviewing your medications with your doctor to make sure those are not contributing. Another common symptom that a lot of people have is acid reflux. It's fairly common. It's triggered by spicy, greasy foods, late night meals, caffeine. There are some risk factors for acid reflux, one of them being obesity, especially abdominal obesity. So when we start gaining waist circumference, it increases risk of acid reflux. There's underlying conditions like a hiatal hernia, which can develop with age that can make acid reflux worse. And then diabetes generally slows down the GI tract and increases risk of acid reflux. These are some recommendations from the main societies, but the ones that are really important are eating 3 hours before bedtime, avoiding alcohol, caffeine, smoking. It says lose weight any amount. So what we have found is that overweight individuals, once they lose weight, we will start seeing improvement in their acid reflux. If you are having bad reflux at bedtime, then keeping the head of your bed elevated also helps. Keeping meal sizes small, and I mostly tell people to eat in a pyramid, which means your biggest meals of the day can be breakfast, lunch, and then as you go towards the dinner time, dinner should be the lightest meal of the day. Reasons being, it's close to bedtime, you don't have much physical activity. If you eat a heavy meal at bedtime, you're going to stimulate gastric acid, and you will have heartburn or acid reflux at bedtime. Avoid extremely tight-fitting garments. And then again, there are medications that can affect your lower esophageal sphincter, but we don't have to go into the details. Those we can go in detail with our doctor if we are on multiple medications. And then stress reduction, believe it or not, most GI conditions, you can have a flare-up of your symptoms if you're in a high stress situation. So always remember, if you are in a stressful situation, if there's anxiety, managing all of that will overall really help your GI symptoms. Medications are very simple medications. Omeprazole, it's called Prilosec. It's available over the counter. It's first line for acid reflux to start one in the morning, half an hour to 45 minutes before breakfast. You can take it for a few weeks and you will find significant improvement. Obviously, if it's not better, you'll see your doctor, but very safe to take Prilosec over the counter or Pepcid, famotidine over the counter. Very, very safe for acid reflux and very, very effective. There's also peptic ulcer disease. So we think of it when you are having abdominal pain, especially upper abdominal pain, sometimes worse after meals. You can also experience some bloating or some dark stools. Very common due to a bacteria called H. pylori. It's very common in the population, very common amongst Indians, and it can cause ulcer formation in the stomach. So if there is that suspicion, obviously we check for H. pylori. It's a simple breath test you do in the lab. If it's positive, we treat it with 2 weeks of antibiotics. We check to make sure the bacteria is gone. And then over time, if there's still gastritis, which is inflammation in the lining of the stomach, we can do some more acid blocking medications. It's always important to consider again, like if you're taking high doses of aspirin, Motrin, ibuprofen, naproxen, Aleve for headaches, for joint pains, and you start experiencing belly pain, then there is a possibility you may have developed an ulcer from the NSAID. So again, important to probably stop the NSAID, talk to your doctor, probably get on Prilosec to help the ulcer heal. Obviously, if these ulcers are causing pain, they're causing significant bleeding, then we do offer an upper endoscopy, which is a visual exam with a scope and a light and a camera, and we check the lining of the stomach, look at the ulcer, biopsy it, make sure it's nothing serious. Gallstones, it's a disease more common in women. We commonly see it in South Asian women. Very typical for gallstone disease, you want to think of if right after a fatty or a greasy meal, you have tremendous pain either in the center or the right side, then it's very suggestive of a gallbladder attack. And if you're having it consistently, then it is a good idea to get an ultrasound to make sure there's no gallstones. A lot of people with gallstones have no symptoms and we leave them alone. But if you're having recurrent episodes of severe right-sided pain, nausea, vomiting after a fatty or a greasy meal, the treatment of gallstones is to get the gallbladder removed. It's a laparoscopic surgery. It's outpatient. It's safe. It's just something to keep at the back of your mind if you're having these episodes of right-sided pain. Colon cancer. So this is a really important one because in India, we currently don't follow protocols for colon cancer screening because the average risk of colon cancer in US is much higher than that in India, but the numbers are going up. We know colon cancer risk increases with age. Many in our community are not screened according to their age. We have to think about this. We start checking for colon cancer screening test at the age of 45. So at the age of 45, you should have one colonoscopy and then one every 10 years if you have no risk factors and a normal colon. It prevents colon cancer. It decreases mortality, which means prevents death by colon cancer and complications. And if you have hesitation about colonoscopy, just ask your doctor to do the Cologuard or the stool test, but do something, get the first line preventive exam if you haven't, because early detection of colon cancer can really save your life and really improves outcomes. So I really want everybody to take home this message. If you've not been checked, either a colonoscopy or a stool test, either is fine. Lactose intolerance is another really common one. So it's extremely common among Southeast Asians, and some studies say it could be 70 to 90% of the population. Lactose intolerance generally starts after the age of 30. So you may be doing great with milk and dairy growing up, but after the age of 30, you suddenly start seeing gas and bloating and diarrhea. And that's because there is an enzyme lactase that is needed to digest milk sugar. And as we get older, the lactase level starts going down. So it's important to keep an eye if we are lactose intolerant, because if that is the case, then you want to avoid regular milk, especially whole fat milk, dairy, and try alternatives of lactose-free milk like almond milk, soy milk, oat milk. You also want to make sure if you're dairy-free, you're getting enough calcium through your other dietary sources, which is green vegetables, tofu, fortified products, calcium supplements. Some of us who love dairy, you can still take lactase enzyme tablets, which is lactate, easily available if you want to consume dairy still. And there are some probiotics, and this is an important one, especially the strain with bifidobacterium. So the common probiotics with that bacteria strain is Align, Cultural, easily available in Costco, Garden of Life. Some of them do help with bloating, indigestion, dairy, and sugar related. So it is something you could try. This is also really important, fatty liver disease. So what is fatty liver disease? It's a condition where excess fat deposits in the liver. Traditionally, people think liver disease, cirrhosis, only happens in people who drink too much alcohol. And then we found hepatitis B, hepatitis C. But the big epidemic in the world, especially in Southeast Asians, is fatty liver disease. Worldwide, it affects 25% of the people. We'll talk on the next slide how common it is in Indians. And there's two kinds of fatty liver disease. One is non-alcoholic fatty liver, where there's fat in the liver, but the liver is not really inflamed. And then there's an entity called NASH, which is steatohepatitis. Steato means fat, hepatitis means inflammation. So this is a condition where there is enough fat in the liver that it's starting to cause inflammation so that your liver numbers may look abnormal, your ultrasound may show signs of fatty liver. And it's important to understand that if we are not able to reverse fatty liver in time, it can lead to end-stage liver disease, which is cirrhosis or liver cancer. So I do want everybody to be cognizant when they get their blood work, are there risk factors for fatty liver, and always keep it at the back of their minds even when you're getting your routine physicals with your primary care. Fatty liver in Indians, honestly, is extremely high prevalence. They did some studies in North India, and they found fatty liver on ultrasound was about 65 to 66%, so extremely high risk of fatty liver. I think it's linked to our high association with metabolic syndrome, which is diabetes, high cholesterol, obesity, which is another big problem plaguing our populations. In South India, the prevalence of fatty liver was close to 50%. So we talk worldwide fatty liver is 30%, but you talk about Indian population, it's close to 65%. So this is typically something that I think all of us as Indians have to be very cognizant of and really be proactive to make sure your liver is in good health. The high prevalence in India right now is influenced by factors like urbanization, lifestyle factors, and just the increased incidence of metabolic syndrome, which we'll just spend a few minutes over in the next slide. So what are the risk factors for fatty liver? So obesity, and I want to remind everybody that for Southeast Asians, for all of us, the BMI index is slightly different. So if for Caucasians, a normal BMI is 19 to 24. Indians, because we don't have as much skeletal muscle mass, just ethnic differences, a normal BMI for us is 18 to 23. So if your BMI is over 23, and we are Southeast Asian men or women, we would be considered obese. So really something to think about when you weigh yourself and watch your weight over time. The other risk factors are type 2 diabetes, high blood pressure, high cholesterol, and then what I've mentioned is the metabolic syndrome. Metabolic syndrome basically means central obesity. So when you start gaining weight around your waist, insulin resistance, which is the precursor before you develop diabetes, and then high cholesterol, low HDL, elevated triglycerides, and high blood pressure. So all these are risk factors for fatty liver. So if you have any of these risk factors, it is important to talk to your doctor. Well, am I at risk for fatty liver? Are my liver numbers normal? Do I need an ultrasound? Do I need to see a hepatologist or a liver specialist? Because all of us in the GI and liver community are working very hard to prevent progression of fatty liver disease. The test for fatty liver is generally liver tests. So there's some blood tests, AST, ALT. Typically, if there's high suspicion, we'll do an ultrasound. And then there's some special tests like fibroscans and elastography. They can actually assess if the fatty liver has caused scar tissue in the liver, because scar tissue is what causes cirrhosis. So we have a bunch of tests now that can actually help assess how severe your fatty liver disease is. And it's important to remember that you may have fatty liver without having any symptoms. It's often found during a blood test or during an ultrasound. So, you may not feel anything if you have fatty liver. You may feel completely fine. Management of fatty liver. So the first line treatment for fatty liver is always weight loss. So if you're overweight, losing 5 to 10% of your body weight, we know it starts causing reversal of inflammation in the liver. Healthy diet, we've talked about this, so vegetables, fruits, whole grains, unsaturated fats, avoiding saturated fats, which is extremely like fried foods, and watching your carbohydrate intake, which is very high again in our diets, will all help towards reversal of fatty liver. Regular physical activity, it's the same thing, 30 minutes, 4 to 5 days a week. So 150 minutes of cardio in a week is considered a good number. And then avoiding alcohol. So what we have found in studies is that if you have fatty liver, even if you're consuming small amounts of alcohol, social alcohol, 1 to 2 drinks a week, it can really expedite the rate of liver damage and progression to cirrhosis. So really watch your alcohol intake if you have fatty liver disease. The good news is that, till last year, diet lifestyle was the only thing we could offer to people with fatty liver. Now we do have a medication approved for fatty liver. It's called Resdifra. It's very safe. I have several patients on it. If you have more advanced fatty liver disease, it's something that could actually help your liver. And then just briefly about irritable bowel syndrome, I think this is something a lot of us struggle with. Irritable bowel syndrome is abdominal pain, cramping with irregular bowel habits. It's considered a DGBI, which is disorder of the gut-brain interaction. To say that a lot of these symptoms are coming from the imbalance of the axis between the gut and the brain. And now there's more and more studies that show that if you're stressed, if you're anxious, then it affects the neuropeptides, which are the hormones in your gut, and also affects your microbiome. And so stress can cause GI symptoms, and GI symptoms can worsen stress. So it's a two-way street. So more and more when we're dealing with IBS and some of these functional GI disorders, I think we're also talking about, besides the microbiome and what you're eating, management of stress and other lifestyle factors. These are problems, like I said, how gut and the brain communicate. There may not be a visible structural disease, but you might have a lot of symptoms like gas and bloating and indigestion, but all the tests keep coming back normal. It happens because of dysregulation of the axis between the gut and the brain. The gut is called the second brain of the body. So when that axis is imbalanced, you're not going to feel so good. Stress, anxiety, trauma, previous GI infections can increase your risk of IBS. And then common symptoms, like we talked about, are abdominal pain, gas, bloating, diarrhea, constipation, early satiety or fullness, nausea, and direct correlations with stressful situations. I want to tell people who do suffer from IBS and who've had testing and it's always come back negative. If somebody's told you it's in your head, I don't think it's in your head. These are recognizable conditions. It's diagnosable. It is treatable. And generally, it takes a team approach for patients to feel significantly better when they have multiple GI complaints and symptoms. It's a multidisciplinary approach. Sometimes we'll use medications. Sometimes there are elimination diets that'll help. And then really behavior health support, whether it's behavior therapy, hypnotherapy, stress management, all of that together helps manage IBS better. This is again, so all the armamentarium of things that we use for people with IBS, so medical therapy, dietary changes, and behavior health support to the best of our ability. I do want to just share some low FODMAP Indian foods. So these are foods that traditionally cause less gasiness, less bloating. So it's rice, quinoa, carrot, spinach, green beans, papaya, moong dal, tofu. There are certain foods that are considered high FODMAP foods. These are foods that when you consume them, they cause excess gas and bloating and indigestion. These are my favorite things too. So unfortunately, they're on the list, but it's onion, garlic, wheat, rajma, chana. These are commonly bloating foods. You don't have to avoid them completely, but if you're feeling extremely gassy, bloaty, if you're having an IBS flare-up, those are probably not the best foods for you. And sometimes it does help to work with a dietitian to help personalize what can be the foods for you to eliminate and what can be the foods for you to introduce and keep in your diet on a regular basis. Just a few minutes on stress management. So stress management is very integral to the management of IBS. Now we have professional help with gut-directed CBT, hypnotherapy that helps quality of life. But we've also seen mindfulness, meditation practices. Those can also help chronic GI conditions just because of what we talked about, the interactions of the gut-brain axis. So just some final thoughts here, and then we can open this for questions. It's important to remember that aging affects gut function. There's changes in motility, microbiome, digestion, which can lead to issues like constipation, reflux, malabsorption. Diet, lifestyle, and genetics matter. So it's important to understand your unique dietary patterns, go through your family history, and see if there are certain genetic predispositions. Early detection is extremely important. So colon cancer screening should start on time. If we have risk factors for fatty liver, I think it's good to have that conversation with your doctor that, am I getting checked for fatty liver? Are my liver labs okay? And then just continuing to work on nutritional, lifestyle, exercise, and stress management, because those are the pillars of health and overall use for good health, good gut health. And then multidisciplinary care, your internist, your gastroenterologist, the whole team can work together to help you feel better. So that's it from me. Open to questions or anything, any comments.
All right. Thank you, Dr. Treta. Maybe you can stop screen sharing.
Oh, yes. Okay.
All right. Thank you. That was quite a packed presentation. So thank you. That's awesome. And you covered a couple of things. So maybe I'll kickstart some question and people can add as we go.
Sure.
One thing surely got my attention, which most senior would like to hear, was the lactose intolerance. And that's shocking numbers to see.
Yes.
70% is a quite high. And what might be the reasons and maybe the source of dairy, organic, non-organic, homogenized, non-homogenized, can make any difference or no, or boiling milk and not boiling. Those were the questions. That was one. So
Yeah.
maybe let's go one by one and then.
Yes, yes. So great question. So I think the basis of the lactose intolerance is the deficiency of the lactase enzyme in our gut. But to your point, it is correct. I think we are exposed to over processed foods here, and sometimes it's the processing itself that is creating some level of intolerance. We do see examples where if people switch to organic milk or when they have dairy in India, they have no symptoms, but when they're having dairy here, they're just much more symptomatic. So I think there is some variation there. Definitely including milk and other food products, organic is definitely better. Boiling versus non-boiling, we have not seen a big difference. Fat is also sometimes causes GI symptoms in patients, so we say low fat, but low fat comes with a caveat that it's again more processed. So I think having in small amounts is okay, and not being excessive in consumption of dairy if you're having symptoms. I would start there, and definitely organic milk is a good idea.
Okay, and then the other question was about the fatty liver. There is not much awareness in our community about fatty liver,
Yeah.
especially you know, and both ways means alcohol consumption and non-alcohol consumption both ways. So maybe you can shed little highlight on that one to say how
Yeah.
people can get screened or what can they do to bring it into the.
Yes, yes, definitely. So I think a couple of things to think about. I think it's very common to have two risk factors, right? High blood pressure, cholesterol diabetes, cholesterol obesity. I think majority of patients or majority of people fit those criteria. And then just being Southeast Asian, we are high risk of cardiovascular disease and metabolic disease. So I just like to say, I don't want to put a blanket statement, but most of us are at high risk for fatty liver. So the first conversation when you have your routine physical, you should look at the CMP, which is basically the two most important numbers on them are AST and ALT. And if those are elevated, then definitely you have to ask your doctor that, I need more testing. And more testing, there's a couple of things. One, there's universal screening guidelines where all adults should be checked for hepatitis B and C. So if you've never been checked for hepatitis B and C ever in your lifetime, you should get a one-time check. We see a lot of undiagnosed hepatitis B in the Indian population because hepatitis B is an inactive disease. So you may not have any symptoms, you may carry it for a long time, you may give it to your kids. So sometimes we'll see pregnant women coming on with hepatitis B, they probably got it from their moms. So one, if your liver numbers are even slightly high, getting checked for hepatitis B and C, and then getting an abdominal ultrasound. An abdominal ultrasound is a very low cost procedure. It generally gets approved by insurance. It's non-invasive. It takes 20 to 30 minutes. They just scan your abdomen, and it's very sensitive for fatty liver. So if the ultrasound does show, they'll call it fatty liver, then yes, it is time to start working on everything we talked about: diet, lifestyle, weight loss, working with a nutritionist if that's possible, talking to your primary care. And to Dr. Deshmukh's point, it's true, the awareness for fatty liver, even in the medical community, when we talk to general internists, is pretty low. So most of the times they'll say, oh, it's not a big deal. It's just mild fatty liver. We'll just monitor it. But I think if there is ever fatty liver, you should advocate for yourself and say, I want to see a gastroenterologist. I want to see a hepatologist. Because most of us in office, we have something called the FibroScan machine, where we can actually scan the liver to see if there is scar tissue, if there is fatty changes that are more aggressive. And there is a scale. So everybody's on a scale from 0 to 4. And now we know if somebody falls in 2 to 3, there's a very safe medication. So there's a lot we can do to reverse fatty liver now. So yes, I think if you have risk factors, you should ask for screening. And definitely if your liver numbers are high, you should ask for an ultrasound and get checked for hepatitis B and C.
So what happens if you have fatty liver?
Well, so it's a slow progressive disease, but uncontrolled fatty liver can result in cirrhosis, which means what happens is your liver cells have fat in them. So fat causes inflammation. So the first stage is steatohepatitis, which means the liver is inflamed. But after a while, chronic inflammation, just like anywhere in the body, causes scar tissue. So scar tissue is just fibrous tissue. So your normal liver cells are getting replaced by scar tissue. When more than 75% of your liver has been replaced by scar tissue, that's what we call cirrhosis. So cirrhosis is end-stage liver disease. About 20% of patients with fatty liver will progress to cirrhosis. So if we don't control fatty liver, yes, we increase your risk of cirrhosis. Yeah.
Thank you.
Yeah.
And Baljit, why don't you ask your other question?
Oh, another thing of BMI index.
Yes.
I'm obese and it's over 30. So how do I reduce it?
Yes. So there's a couple of things for BMI. The first one I always start with is intermittent fasting. If you don't have chronic issues with acid reflux, if you're overall in good digestive health, then intermittent fasting, we know there's a lot of data on it. It decreases inflammation, it lowers your glycemic index, it boosts your metabolism. So it's called 16:8. That's the easiest to do. So I tell people either you skip breakfast or you skip dinner. So, either you eat your last meal at 4 p.m. and your next meal is at 8 a.m., or you eat your last meal at 8 p.m. and your next meal is at 12 in the afternoon. So that's number one. The second is honestly looking at your carbohydrate consumption. If you look at your plate, you can use a fistful rule. 1/3 of the plate should be protein, 1/3 should be carbohydrate, and 1/3 should be fat. I think in a vegetarian diet, it is very hard to get that balance. So what I tell people when they have a BMI over 30, just straight off the bat, cut your carbohydrates into half. So if you're having 2 rotis, cut it to 1. If you're having a bowl of rice, cut it into half. And then also look at other things, right? So if you're having lentils, so lentil is a source of protein, but it's also a very high source of carbohydrates. So it's important to understand what is your total carbohydrate intake. And then second, it's very important to start integrating protein in your meals. And then, vegetarians generally struggle with protein intake. So the good sources of protein for a vegetarian diet, if you eat eggs, obviously there's egg whites. If you don't eat eggs, there's Greek yogurt. Fat-free Greek yogurt is an excellent source of protein. 1 bowl of Greek yogurt, fat-free, can give you 18 grams of protein, right? So very important to incorporate that. Important to start incorporating tofu. Good quality, well-sourced tofu is a great source of protein. And then lastly, it is okay to have a high-quality protein powder or a protein shake in your diet. We also, this is unrelated to GI, but as we get older, we start having muscle mass loss. And that's more in women, especially perimenopausal women. So if we don't increase our protein intake, we're going to have muscle mass loss, which is going to cause osteoporosis. So you have to keep upping your protein intake as we get older to prevent muscle mass loss. The other thing is, as you lose more muscle, it starts getting replaced by fat. So that's why we start having higher risk of fatty liver disease. And then lastly, to introduce some creatine, like generally 5 grams a day is a good idea. So 5 grams a day of creatine to again increase your muscle build, muscle composition.
5 grams of what?
Creatine. It's a supplement. It's a muscle building supplement. It's creatine. Creatine.
Yes.
It's very, very safe. And again, highly recommended postmenopausal, but also older men to prevent muscle loss. And then fatty liver, we also say that while you're doing all the diet, exercise is very important. So exercise, you start with the basic 30 minutes of moderate activity, 5 days a week. So 150 minutes of moderate activity a week, but also weight training. So weight training is also very important because as you weight train, you're replacing fat with muscle, which is again very, very important as we get older. So weight training, you can start simple. You can buy ankle weights from Amazon. You can put it on your ankle, walk with it. There's also a lot of data now on weighted vests. So if women wear weighted vests, it prevents risk of osteoporosis. It helps muscle building. So if you're working in the kitchen, working in the house, taking a walk, just wear a weighted vest. And then as you progress in your physical journey, then actual weightlifting is considered also good management for fatty liver disease. So a lot of things for you to work on to start getting that weight to shift and to improve your BMI.
Very good. Thank you so much. That was good.
Yeah.
Thanks.
You talked about the yogurt. Has to be Greek yogurt or any yogurt is good?
Greek yogurt, because it's strained. When they strain the yogurt, the protein content goes up. If you have regular yogurt, you'll get 6-7 grams, and you'll end up having more carb and fat. So definitely Greek yogurt, and you can make it at home. There is YouTube recipes. You can strain it, make it at home, but it has to be Greek if you're doing it for protein.
And you talked about protein. How the nuts also have some protein?
Yes.
So is it good to start morning with the nuts or not?
Yes, so it's interesting, there's mixed data on that, but nuts are great sources of protein. You just have to watch the amount that you're having, right? And you have to watch different nuts. So I almost tell people like, you should look at the back, like peanut versus macadamia versus cashew. They all have different protein intakes. And if you're having 4 or 5 nuts in the morning, I think that's fine. If you're having 20 to 30, then you're having too much fat. Another thing I tell people, if you're just starting to like watch your diet and you're not sure how much protein, how much fat you're getting from everything, you can use MyFitnessPal. It's a great app. You can put your meals in there. I use it myself. And it really gives you a breakdown, one of what you're eating and what are your macros. Macros is how much carb, fat, protein you're having. And you can set goals. So if you want a high protein diet, it's going to give you recommendations on what are good diet choices for you. So I really recommend that tool for people who are just starting to understand their nutrition better.
Can you please repeat that app?
Yes, it's called MyFitnessPal.
Oh, MyFitnessPal.
So
Write it in the chat here.
yeah, another interesting.
I have that on my phone, but I never used it.
It's a great app. Even the free version is good, but if you get the pro, which I don't have, you can scan everything you're eating. You can take pictures, and the AI will give you all the breakdown of the nutrition.
The other interesting part for our seniors group is eating, the gut biome and all those. So
Yes.
the main problem is because loneliness, many are alone, and a lot of meals are done in front of the television and watching some whatever means, it's not a very conducive
Yes.
environment for eating a proper meal.
Yes.
So maybe you can shed some insight on why it's important to have proper meal and
Yes.
the right environment for eating and how it impacts your thinking and like a lot of things. Yeah.
Yes, for sure. So I think that's a really good point. So mindful eating is a very important part of eating. It's a very important part of digestion. And as they say, digestion starts here, right? So your salivary glands produce saliva that helps break down food. So digestion starts as soon as you put something in your mouth. So yes, it's very important to eat mindfully. One, because if you're engaged in something else, you really don't know what you're eating, how much you're eating. You can keep snacking on things while you're watching TV. And the second is the benefits of the food that you're eating. You know, the microbiome is very sensitive. It is sensitive to stress. It is sensitive to what situation your brain is in. And yes, if you're eating in a conducive environment, if you're with someone, having a meal on the table with people, mindfully eating does help your microbiome. If you're stressed, if you're distracted, if you're watching TV, yes, your microbiome will be affected by it. It's called neuropeptides. So what you release in the brain affects, it does supply in the gut and it affects your digestion. So I agree. Mindful eating is very important. Also, planning your meals is very important. Just not eating on the go. Like, you should know in the morning, like this will be my breakfast, this will be my lunch, this will be my dinner, this will be my snack. When you plan your meals, you tend to eat healthier, you tend to eat cleaner, and it's generally good for your gut health, for your overall health as well.
There is a question about
One
I
question,
the
one question that
proteins
I have
into
is
the
regarding fiber.
chana.
What is the right time to take fiber supplement, like
Yeah.
isabel?
Yeah, so typically, it doesn't matter. You can take it any time of the day, but for regularity, I do tell people you can take 1 to 2 tablespoons at bedtime so that, you have regularity, you take it at bedtime, and then, generally the bulking laxative or the bulking agent like a fiber will help you have a bowel movement in the next 6 to 8 hours. So you can take it at bedtime. If you're taking Miralax or something with it, great time to take it at bedtime.
And then the same connection of the fiber, there are two types of fibers as far as
Yes,
I know. One is soluble and the insoluble.
yes, yes.
This whatever
Yes.
that is bulk forming is the insoluble one. Is that right?
Right. Well,
And
so it's a great question. So the thing is that soluble versus insoluble fiber, they both are bulk forming agents. They both help gut motility. They're great for constipation and just regularity. The problem with insoluble fiber like Metamucil or Isabgol is it can cause a lot of bloating because when it gets absorbed, when you take it in, it absorbs water and swells up. So I do tell people if you have issues with bloating, indigestion with fiber, then there's two alternatives. One is Citrusel, which is a soluble fiber. It's more easily tolerated. It causes less bloating. And I'll put it here. And there's also a fiber called Sun Fiber. It's a low FODMAP fiber, which means it causes less bloating, less indigestion. It's gluten-free. And it also has some good probiotic strains. So I do like Sun Fiber a lot too. It's easily available on Amazon.
what is your opinion about inulin?
Inulin, it's a good, what we call a probiotic. Okay, so what are probiotics? Great segue, right? So what is a probiotic? So it's a prebiotic, sorry. So probiotics are live bacteria that help the gut health. And a prebiotic is a fiber, it's like food for the bacteria. So if you have good
That's correct. Gut
prebiotics,
bacteria.
yes, if you have good prebiotics, it's going to be a substrate for the bacteria to grow. So inulin, and then just having high fiber foods, having lots of berries, fruits, vegetables, those are all sources of what we call prebiotics. There's good fiber for your gut and a good substrate for the bacteria to grow. Yeah, but you don't have to take excess amounts or anything.
Okay, Jagdish has a question.
Yeah, I've got a question. We just mentioned that stress is one of the main causes of all this problem, GI problem. And you mentioned there is one famotidine, and
Yes,
these are very safe. You can take
very
it.
safe. Yes,
Yep,
extremely
okay.
safe.
I've got a experience with this. I had been taking a few years back, I mean, this regularly because of this problem. And then my doctor said, take two, one at morning, evening, right?
Yes.
So I'd been taking, it didn't help me in a way. But to great surprise, I developed something skin problem, which is because of this famotidine. If you take so regularly, it can cause the skin problem and sun sensitivity.
Photosensitivity.
Yes. So suddenly I noticed my whole this neck, this area, this is gone red, absolutely.
Got it, got
So
it.
the primary doctor sent me immediately to the dermatologist.
Okay.
She just came inside, just announced, stop this medicine, this is causing it.
Got it,
So
got
this
it.
is when you say this is safe, I don't think so. I keep telling anybody I talk to, they say this is we are taking this. I said just stop it and don't take it that regularly. And then after that, to be frank, with my own experience, I controlled so much my diet intake. With the diet, you can control your this problem.
Yes, yes. So that's an excellent point, right? So first off, famotidine, this kind of photosensitivity, extremely, extremely rare. So I think you're one of those very, very rare zebras. I have not seen it in my 10 years. It's extremely rare. So that's why it's an over-the-counter medication. So
Because
overall,
sometimes people do not know about this thing, what is causing this problem, right?
correct. Of course. I mean, not one person can know everything, but just looking at guidelines and literature, famotidine overall is very, very safe.
I've
Of
got
course,
a question. I'm not, I don't feel offended. My own daughter-in-law, she's a doctor. There are so many in my family doctors, so it's not that. But I've got one question. When patient come to you with their problem, something like that, do you right now, this is the time, do you stress on telling them to first control the diet and control the other
yes.
thing rather than giving immediately so many medicines? You go to one doctor with one problem, for the other problem you have to go to another doctor. He gives you two, three different medicines, but the tummy is only one, right? Which is
Yes.
affecting the whole thing.
So if you listen to my talk, I stressed a lot on diet and lifestyle, right? So I'm a big believer in diet and lifestyle. And I do think the first line approaches, even from the GI societies, when we talked about GERD, like if you go back to the slideshow, the first thing was diet, lifestyle, caffeine, stress, then was lifestyle interventions, and then was like, if nothing else works, you can take a Prilosec or a Pepcid, right? So 100% diet and lifestyle is first line, whether it's for acid reflux, whether it's for constipation, whether it's for fatty liver. And it's not just me, it's the whole army of GI societies where we feel lifestyle is a very important factor. Where people struggle, what I have seen is lifestyle changes are not that easy. But yes, if I see a patient in my office, we have handouts for acid reflux. We are giving a lot of education, just simple things like we're talking about right now, like don't eat late at night, decrease your waist circumference. So I agree. Monitoring your diet, changing your lifestyle, stress management, majority of GI symptoms, like I mentioned in my talk, will get better just with that. But I also need you to know that if that doesn't work, there are some options that might help you. And of course, there will be a rare interaction with the medication like you did, which is very unfortunate. And yes, I think the new generation of doctors are not pill pushers in my experience. I think we are more about whole person. We talk a lot more about stress, gut brain, talking to a therapist, getting a dietitian. Because, like you said, you have one stomach, but it is completely connected to your gut. And so, treating the whole person is very important than treating a system. And they're all connected, right? We said fatty liver connected to metabolic, connected to cardiac risk, connected to stroke risk. So, when you monitor the pillars of health are sleep, diet, exercise, social connections. When you do all of those correctly, most people can treat or prevent chronic medical conditions. And I think the WHO and the physician community is making a big push for that. So really good point, though. Thanks for bringing.
Yeah, there's one more point. Maybe it will help the whole group. This problem with this gas problem, we have got in India that isabgol, that is metamorphosis, which you just said it's available on Amazon. No, it is very cheap and it is available on all the Indian stores. It's called isabgol.
Yes.
No, yeah, everybody knows about it.
Yeah, we all have that.
Yeah, so
We all
that helps a lot.
That's fiber.
Gut, yeah.
Yeah.
Yes.
Gut
And
problems.
the thing is, that fiber another question is, sometimes it's not that we take too much fiber also.
Yes.
Because thinking, oh, I don't have enough fiber in my food, like she's talking, Jagdish ji, about
Yes.
isbgol. Sometimes I put that in yogurt to make it like, okay, I have a fiber and a protein. Okay, I did not have enough protein today. So, Dimag all the time thinking how to balance the food. Being a vegetarian, it is not easy to balance protein and the
Yes.
fiber and everything. Everything has a carb there. So again, the issue comes there. Do I need a carb or I need this?
Yes, yes. So it's a really good point. So that's the issue with isabgol, right? So for people who it works for, it works really well. But yes, it's an insoluble fiber. We know it causes bloating. And that's when the fiber, when you're taking that 25 to 30 grams of fiber, if you're sensitive, you want to take more of the soluble fiber. So for example, like the sun fiber, it has low FODMAP. So low FODMAPs are foods that cause less bloating, less indigestion. And then the slideshow has a list of low FODMAP Indian foods where you can get your fiber, but without the bloating and the indigestion. And then there's a whole science to low FODMAP. There are books written on it. Unfortunately, there are not Indian books written on it because low FODMAP was discovered in Australia. So the book is by Sue Shepherd, which tells you how to deal with bloating and how to make low FODMAP meals. But now there is an increasing plethora of Indian dietitians who are very good, who are trained in low FODMAP and who can really help. Maybe after the call, I can share some resources. I know a dietitian in India. She's excellent. She does Zoom calls and she manages obesity, metabolic syndrome, IBS with the Indian context, right? So I think now there are resources. And I do think within our means, whatever we can use in terms of dietitian, personal trainer, therapist, whatever it needs to make this whole person exist in a happy, symbiosis, we should do.
Okay, I have last question for you,
Yeah.
which is very close to everybody's heart. That's the question is the sweets and the chai. Purnima, wait, please. So the sweet and the chai. So, there is always big push for sweets and also
Yeah.
the people can't go without chai. So what are your take with the pros and
Yes,
cons?
yes. So I will start with saying I love chai myself. And then second, I think, and I think chai is not all bad. So let's start with the good about caffeine and chai first. So tea, coffee, caffeine, we know these things have high levels of antioxidants. There is research now that, drinking a cup of coffee a day protects people from liver cancer. So there is some protection, some antioxidant protection there. But just like everything else, I think it has to be in moderation, right? If you have acid reflux and if you're having 3 to 4 cups of caffeine, chai a day, you are going to have reflux symptoms. Second, high fat foods will precipitate reflux, also increase risk of fatty liver. So if you're having a full fat chai 4 times a day, you've crossed your carb and fat intake very quickly. So I think being mindful of, like, if you really like your chai, I tell people have it once a day. Have it either in the morning with a slice of toast or your breakfast. Have it in the evening, but you have to limit your consumption. You also have to look at what's going inside the chai, right? Is the chai being something where you're drinking it because it's really sweet? So then that's not a good idea. Sugar is a very important thing we should talk about. So sugar is, again, a very big risk factor for diabetes and for fatty liver. If you're overall not adding a lot of sugar in your diet, and if you're having 1 teaspoon of sugar in your tea, I think that's okay. But if you overall are having a dessert after every meal, and then you're having sweet tea 4 times a day, I think you are really increasing the blood sugar spikes in your body. So I do think having sugar free, if it's not an option, then less sugar is definitely something to consider. I also want to, people say, I'm having coconut sugar, I'm having gur. They're all forms of sugar. They all cause blood sugar spikes. So it really doesn't matter except the processing factor. So overall, I think we should decrease our sugar consumption. And 1 cup of tea, I think, is okay. But anything more than that, I think, could be excessive, especially if people are having excess GI upset. And the last thing, I don't know how many of you guys are doing it, but I see my parents in India do it all the time. When they have chai, they have snacks with it. So, chai is chai. If you're having a bowl of like snacks, which could be anything, that all the attractive things in the Indian store, even a bowl, then again, that's 300, 400 calories right there. So everything you did in the day, if you're having 2 cups of chai with that bowl of snack, it's kind of game over. So also when you have chai, just have chai. Don't make it kind of an excuse to have a bowl of some snacks, right? So again, very mindful eating with your snacking also very important.
And the sweets.
Yeah, you are absolutely right. Most of Indians, I mean, we all, whenever
Yes,
we have a tea and coffee, we have to have some snack with it, you know.
correct.
We
Correct.
have to have a munching. It's our habit.
Yes, it's a habit, and we have
A
to
habit.
break that habit. Yes, yes. And there is always healthy snacks, right? So you have to look into and see, like, what can I have? If I want to have my 5 spicy almonds, I'm going to have it with my tea. So you can have your nuts with your tea, but it has to be 5 or 6. It cannot, again, be a bowl full of any of these snacks, right? Or carrots and peas and things like that we talk about. Those are healthy snacks. Edamame is a very, very healthy snack. It's vegetarian. It's a very high source of protein. It tastes really good. You can steam it. You can roast it. Those are things, if you have with your tea, actually will help you. And sugar, yes, sweets. So sweets, honestly, again, very, very big risk factor, very high risk of, very high in fat and very high in sugar. So, sweets should only be limited to holidays, but not outside of that. I do want to remind all of us that as Southeast Asians, like if you look at the cardiac risk, if anybody does a cardiac risk, which means your risk of having a stroke or a heart attack, you get 1 point for being Southeast Asian. You get 1 point right off the bat, right? So this is an irreversible risk factor that we cannot change. So think about it always that you are at a higher risk already. And when you increase your sugar consumption, your risk is going high. So anything that causes diabetes, cholesterol, in a Southeast Asian increases risk of stroke and heart disease. So definitely would cut down on sugar consumption. I think sugar should only be added in tea, but nothing else.
Very nice.
And what about I was reading the elaichi, the cardamom had some counterbalancing effect on the caffeine or tannin.
Oh, I'm not aware of that. Maybe if you are aware of it, you should enlighten me. I put it in my tea. I like it, but you should maybe
Yeah, I
enlighten
was
us.
reading that it does counterbalance. And the
Okay.
last question, Purnima ji, you have a question, be quick.
I'm saying that IBS is very common. I have from a long time and it never goes that thing. Even I've taken so many times medicines for a week, for a 15 days, but it doesn't work.
Yeah, yeah. So I think, IBS is one, it's a little bit like anxiety, right? So it's something that you live with, and then you flare up, it goes up, goes down. But I do think it's important to like work with if you have a GI, to work with them, if you've never been on an elimination or a low FODMAP diet, you should consider it. You should consider, like, are these things happening more when you're stressed out? Considering what are the stressors, how you're managing them, and then some medication support just to reach like a steady state. But yes, there's a lot available for IBS now. And if you haven't seen, like if you saw a GI a few years ago and they gave you a few things, I think now there's so much more that can be done.
Because after that we feel constipation and sometimes feel fissure. Then
Yes.
everything goes on the back.
Yes,
Again.
yes. So, and it is important to treat those symptoms, right? Because if we don't treat your constipation, you can have fissures, you can get complicated hemorrhoids, rectal bleeding, pelvic dysfunction. So, I don't think you should struggle. I do think you should talk to your GI if you have one. But now there is, even just for IBS constipation, there are 6 to 7 medications. And again, somebody will point out that there is medication, but if you're not getting better with lifestyle, there's very safe, very good medications that you can use as a bridge to get better. So there's a lot more to treat now, a lot more options that we have now.
All right, thank you.
Amla, like that things, amla powder.
I mean,
Like
it's not something I learned in my training. I don't use it, but if you
when we use the isabgol and all that things that make the stool bulge, and that is also again common problem for
yes,
fish.
yes. I think for IBS-C, there are some very specific things. There are some medications that we have used, like Linzess. There's very specific medications that work on cells in the colon that help reduce gasiness, bloating, and also help what we call complete evacuation. So one good bowel movement a day. Lots to try, I can tell you that.
I think, doctor, you
Thank you.
mentioned
Thank you.
earlier about magnesium. I think
Yes.
magnesium has multiple good effects.
Yes.
So that's what you should look at it too.
Oh, yes, yes. I think she has more severe constipation, but yes, you can definitely start with magnesium. Magnesium is safe. You can start with 200 magnesium oxide available over the counter. Start with 200 milligrams, can easily go up to 400 milligrams very, very safely. And then
Simple magnesium.
fiber, citrusal, sun fiber, and then Miralax 1 to 2 tablespoons a day.
Yeah,
Generally,
Miralax I
that
use.
combination will start moving most people.
Okay. Thank you.
Thank you, Dr. Treta,
and
Veena.
lot of water also. Lot of us don't drink enough water.
Yes.
Very
I
important.
use
So,
lot of water. I use lot
yes,
of
a
water.
water bottle like that.
Vijay Bhai is showing his bottle.
So 2 to 3 liters of water a day. If you guys don't remember, Amazon has those bottles with the markings of the hour of the day. And so just get that bottle and just move with the markings of the day. Your goal should be to finish that bottle in a day.
Okay, my another question is sometimes, whole day you did not drink enough water. At the end of the day, you remember, oh my
Yes.
God, and you drink 3 glasses of water before sleeping.
Yes.
That is bad or it's okay?
It's not bad. It's
So
just
if you don't mind
wake
getting
up at
up,
night to pee.
No, I do get up, but still, at the end
That's
of the
fine.
is
If you are in good shape, your kidneys can handle the water, right? They're just going to pee out the excess water. So you're fine. You just don't want to get to the point where your urine is getting dark, you're getting dehydrated. That means you're way behind in hydration,
Yeah.
right? But if you drink 4 glasses of water and go to bed, that's fine. Water is the best thing you can do for your body.
I think if I mistake not, it's suggested that in the first thing in the morning, you should drink
2 glasses.
at least 16 ounces of water.
Yeah.
Because
Yes.
overnight it is dry. The whole thing is dry. Your gut is dry.
Correct. So there's some alternative complementary medicine where, there is that water, warm water. I just say water. Just drink as much as you can, and it's good for you. But yeah, wake up, have a glass of water. It helps your bowel movements. Sure.
All good.
Okay, I think we had very amazing
It is
program,
amazing thing.
and I'm
Yeah.
sure it intrigued a lot of interest
I
and
think
also
मेरे को लगता है ये mental भी है, थोड़ा सा mental भी होता है.
yes.
When I'm like, if I have to go somewhere, then I can go in the morning, early in the morning. I have to be relaxed in the morning. This is what I feel,
No,
and
you're
as soon as I see my coffee is getting ready, before that, it automatically, I
Yeah.
think I'm
Yeah.
thinking that way. It is maybe my mental that, oh, I'm thinking that way.
No. So the
If
mind,
the body is relaxed, then I go easily. But then I have to go somewhere rushing. My whole
correct.
system get upset.
That is
Yes.
a gut feeling.
Gut feeling.
Yes, so we talked briefly about the gut-brain axis, right? It's very, very important. So if you're extremely anxious, if you're worried, if you're distracted, it will affect how you're feeling in your gut because there's millions of neurons. After the central nervous system, the richest nerve supply in the body is of the gut. So your gut is very responsive to feelings and emotions. So, people on a train, people when they travel, suddenly they can't have a bowel movement, right? So the sphincters contract. It's a sympathetic response. Very, very common. And then you relax and then so it's very normal. And then we talked about IBS, same thing. When people are stressed, they can have a flare up and they can have worsening of symptoms. So that's why the mindfulness, taking a step back, relaxing, very, very important for your gut health.
Is there any effect on appetite in fatty liver disease?
No effect. So you typically won't feel anything. Yeah, unless it's very advanced liver disease. No, you'll feel totally fine.
Okay. So, matlab, people complain of bloating or fullness. That's why I asked.
Yes. So bloating, fullness, typically, gastritis, H. pylori, peptic ulcer disease, IBS. We also have an visceral hypersensitivity. So it's probably all of that, but it's not a bad idea if you have bloating, to get at least an abdominal and a pelvic ultrasound also, because women after the age of 50, we do have increased risk of ovarian and uterine cancers, and sometimes they will just present as bloating. So if you have persistent bloating, you should get an abdominal and a pelvic ultrasound.
So if your ALT and AST are normal in your blood test, it's not necessarily that you don't have any other issues with the fatty liver.
No, because you can have the NAFL, which is non-alcoholic fatty liver disease. You can have fatty liver without elevation. So yes, if you have the risk factors like obesity, cholesterol, you should get an ultrasound just to know. And we do see quite a bit of fatty liver with normal liver numbers.
Generally, the primary physicians generally don't recommend. If they see your ALT, ASTs are okay, then you don't need it.
Yes. I know. And so that's why sometimes it becomes a conversation that I'm worried. Sometimes, I don't tell people to make up things, but you're like, I get bloated, I'm having some changes, you'll get that ultrasound. It's such a low-hanging fruit. We spend so much healthcare dollars and things that don't save things, but this is something I think is important.
Very nice.
All right. Thank you.
We all thank you, Dr. Purohit.
It's an excellent lecture.
Excellent.
Great. Thank you. I'm glad you guys
And
found
thank
it.
you for your generosity with time with us to answer everybody's questions.
Yeah, really appreciate it.
And we also want to formally acknowledge and thank APIO and our friend Dr. Shashwati Kale. She is the president, for helping us to organize this series and bring all these wonderful experts to talk to us and share their expertise and wisdom. So our sincere gratitude for joining us into this program. And I will share her information. You can reach out to her for individual questions we can't answer in the build groups like this. So thank you again.
Where is
Thank
your
you so
practice
much.
located?
So great meeting all of you. Thank you. Bye-bye.
Thank you, Dr. Sachin, for bringing such a wonderful doctors to us.
Sure.
Just wanted to
Thank you
know
both.
what is
Thank
the
you
location.
both the doctors.
Thank you so much.
Thank you.
Thank you, Baljeet ji,
We
arranging
learned a
everything.
lot. We really learned a lot. We all
And
learned a
Veena
lot, and
ji.
we needed this.
I'm
Thank you,
glad.
everybody.
Thank you
you,
so
Sachin
much.
ji.
Great. Thanks,
So,
guys.
So
Veena Jain, next time I come to see you, don't give me sweets.
I did not.
Just give him
He's the
chai.
culprit.
Could you believe it? I don't myself don't eat that many sweets, but once in a while I do eat sweets. What
Yeah.
can you do?
Yes.
Being Indian, we love sweets too.
Yes.
Not every day we eat sweets, but we do eat sweets.
So next time,
Like
get
a
together
child
with no
wants
sweets.
cake.
Yeah.
All right. Bye, guys.
Thank
Thank
you.
you so
Thank you,
much,
Doctor.
Dr. Purohit.
Thank you, doctor.